Now, just over 2 months ago, people living with HIV in Kenya were in distress over a crippling shortage of first-line antiretroviral drugs. Many were forced to ration their medication, altering dosages in a desperate attempt to make limited supplies last longer. Meanwhile, an emergency consignment of ARVs worth $34 million, which is about 4.4 billion shillings at the current exchange rate, sat untouched in a Nairobi warehouse, awaiting distribution since 2024. Now, ironically, the same company, Universal Corporation Limited, has now made global headlines after exporting 72,000 doses of the HIV drug to Mozambique and being hailed by Global Fund for the production of a first-line HIV treatment manufacturer in Africa, yet their effects remained largely unnoticed by the Kenyan national procurement systems.
About a week ago, a significant announcement from the Global Fund to fight AIDS, tuberculosis and malaria. For the first time, they had procured a first-line HIV treatment manufactured in Africa. The producer, Universal Corporation Limited, a Kenyan company located in Kikuyu, Kiambu County. This WHO pre-qualified drugs, a testament to Kenya's manufacturing capability, were exported to Mozambique. The initial shipment alone is expected to treat over 72,000 people there annually. A commendable achievement, yet one that has stirred an ease back home. Kenyans are asking, why is it that the government has overlooked its local capacity, opting to rely on donations and imports? Expenditure inadvertently forced a local manufacturer to prioritize exports over the urgent needs within its jurisdiction. According to Dr. Andrew Mulwa, the CEO of National AIDS and STI Control Program, NASCOP, UCL have been supplying Kenya since 2022, and that Kenya currently has some ongoing orders with the company. However, Pervez Danani, UCL's managing director, says Kenya only procured drugs from them in 2022. Speaking to NTV, Danani, the UCL's managing director, says Universal Corporation Limited currently have no agreements with the Kenyan government, despite their sufficient capacity to supply the Kenyan market as well as several export markets. Danani further says, although Kenya has 1 million patients on HIV treatment, it is unfortunate that not a single one of these patients in need are being treated with WHO pre-qualified medication from UCL. For Universal Corporation Limited, the balance between export opportunities and the healthcare needs of their own nation is clear. Local comes first, but without local procurement, they are compelled to look elsewhere to sustain their operations. A poignant paradox, a Kenyan company producing life-saving drugs while Kenyans in need wait in limbo as the government pursues foreign aid and imports. The WHO-approved HIV drugs in UCL's portfolio include lamivudine, zidovudine, nevirapine, efavirenz, and TLD. According to NASCOP, 1.4 million Kenyans were living with HIV in 2023, with 71,433 children aged between 0 and 14 living with the disease. Their data shows that counties with the highest number of people living with HIV include Kisumu, Homa Bay, Migori, Siaya, and Nairobi. Helen Aura, NTV.